and relaxed here. And so this breathing is similar, except now we're isolating the movement to one side only. You're getting air into both lungs, so just to be clear, air will not just go to one side, but you're sort of isometrically holding one side still while you're getting maximum movement in the other side. So I'm just going to cue Kathryn to breathe into the left side. Again, air is going into both lungs, but she's going to kind of isolate using her abdominals to hold the right rib cage still and feel some expansion in the left side. And she'll do that maybe 3 to 5 breaths. And then after playing around with that, she can try the right side for maybe 3 to 5 breaths. And you'll find that one side is much harder. Like for me personally, I'm just demonstrating it standing, because you can do it, of course, seated or kneeling or any position. I have a really easy time getting air into the left side, getting lots of movement there, and a much harder time on the right side. And why this is important, especially if you are somebody who struggles with SI joint discomfort, why this is important is that the ribs are actually some of the greatest movers of the spine. And so we're now using the breath to move the ribs, to move the spine, which should have a positive effect moving down the spinal column and into the SI joint. So we really want to be clear that if like the right side gives you relief and the left side doesn't, then don't even worry about the left side. This is for you to play around. Really focus on the side that makes you feel the best place of comfort. So it's really not about getting both sides right and being even, because as you know, your SI joint discomfort is usually not even. So we're not trying to achieve symmetry, we're just trying to achieve a good feeling. And our reps here will be, like I said, about 3 to 5 on each side. And the only real thing I want to point out is that when you finish, it's nice sometimes to finish kind of back with the 360 breathing, just so you can compare the sensation of after you've moved, had the ribs move one direction, what is it like now in the full 360? So that's our second breath. The third breath, I'll also teach that one.